Today, I'm speaking with Dr. Mitch Ghen. He is known as the doctor's doctor, seeing over 500 physicians in his practice. Dr. Ghen has spent over 4 decades practicing medicine. We cover a lot in this episode, from hormones to what's in and what's out in the wellness space. I can't wait for you to hear this one. Dr. Mitch, welcome. Here we are.
I'm so happy to be here, Kimberly. Thank you so much for having me on your podcast. It's great.
You're such a pro, though. We were just talking about this because you have a radio show. Talk about all the things that you do.
Oh my gosh. Well, I started off a long time ago. I was actually worked for Jamie Foxx on Sirius XM. That was Foxhold 98. It's not on anymore, but for a year and a half, I was literally their morning show host. It was a open talk show. People called in, asked me anything they wanted about medicine. I like the extemporaneous model. And they would call in from truckers and everywhere over the United States. And I did that for about 1.75 years, almost till he went off the air. I've been nationally syndicated previously, and currently for 14 years, I do a television show that's also in the same extemporaneous format. People call in. It's through the longest running Christian network, WGGS TV, in Greenville, South Carolina. And it goes through The Walk, which is another 30 stations throughout the United States, and it's on the Facebook, et cetera. I've done that every single week from 4 to 5 p.m.
And do you have to go to South Carolina?
Oh, no.
No,
if I do it, there would be no, I could do it. No, it's done literally by home. I have my own little studio at home.
Okay.
It's not as gorgeous as this, but maybe Amber will come over and set it all up for me.
I think Amber would do that for you.
Why not? So that's what I do every week.
I love it. People say that you're the doctor's doctor and that you have over 500 physicians as your patients.
I do. I have literally hundreds of physicians, nurse practitioners, PAs, dentists, you name it in the healthcare field. They reach out to me when they're stuck themselves in their personal life. They'll come to me. It's very nice. I deal with mostly very challenging cases that most don't want to deal with. So if that physician has a challenge, even during normal work week, if they have a problem with a patient, at least 40 to 60 doctors a month will reach out to me about questions for their own patients and so forth. Kimberly, I've been doing this 44 years. I literally, as I say, eat, drink, and sleep this kind of medicine. And I'm constantly studying. I can't tell you I've ever stopped studying. In the process, I've written 4 textbooks. I'm in the process of writing the textbook, the first one ever, on the metabolic cancer as a metabolic disease, basically. I've enlisted 25 other authors throughout the world. And this is going to be a monumental work. It'll be 600-800 pages when I'm done. I'm just about to the point where it's time to start proofreading. And of course, I don't like that because my grammar's not as good as it should be. But I will get others to help me do that.
Yeah, what goes into writing a textbook? I mean, how long does that take?
At least a year. And sometimes this one is over 1.5 to 2 years. I'm an assistant clinical professor at the school in Nova University in the postdoc pharmacy. And for the past 5 years, I've taught this course to postdoc pharmacists, PhDs, as well as physicians throughout the United States. But the person who is the postdoc dean, who I'm very friendly with, he said to me, Mitchell, you need to immemorialize it, I guess, into a text. So I said, okay, I'm going to start working on it. It's a lot of effort. It's tons of research, tons of time. And then especially when you have others who are co-authoring with you, which I have 25, try to get people to do what they're supposed to do on time. You get to that point where it's like you're going to pull your hair out. It's like your kids. Put your toys away.
Yeah.
Same thing.
What a process.
It's a process, yes.
You're teaching pharmacists to compound, right? Is it like a specialty to do the compounding, or?
No, pharmacy schools still, I believe, have at least one course in compounding pharmaceutics. Compounding, I call, back to the future type of medicine. They take the powders off the shelves, they mix it for the individual, and that could be maybe a compound that doesn't exist, a dosage that doesn't exist currently, a methodology. Let's say someone can't swallow a pill, they may make it into a lollipop. People that are listening, your folks that do, for example, Hormone, that could be in a troche in the cheek, or it could be in a cream. So that's the different ways they do it. Now, there are actually 3 textbooks in the world on compounding pharmaceutics. One was written by Lloyd Allen. He's a pharmacist. May he rest in peace. He's gone. The other 2 I co-authored. I did the other 2 in the world for doctors.
Wow. Now, compounding, I feel like, is kind of buzzy right now because people are doing more hormone replacement therapy. Do you want to talk about that? The hormone replacement therapy, it transforms women's lives, I think, in perimenopause and menopause.
Oh, I think you're 100% right. I'll tell you why compounding enters the picture heavily in the hormone space. It does because, look, everyone knows the same size shoe is not going to fit every single person. You go to a shoe store, you may be 7, you may be 8, you may be a D, all different sizes. And even then, there are sizes between the sizes. What compounding allows is the practitioner to make a decision where that person can fall. And based upon their blood work and their needs and their problems and their history and their physical examination, we can determine exactly, or almost as precisely as we possibly can, what exactly makes sense for them. And then you could write a prescription. The compounding pharmacist will follow that prescription. And then there's the other point. The other point is for replacement of hormones, to me, Kimberly, it's important to have something that is bioidentical. By definition, of course, that means that it basically matches what the body has. You don't want to give something that. Now, we don't match perfectly. I'm going to bring this up because maybe you've had someone speak about this before, but they should be aware. For example, we say bioidentical estrogen, and we want it to be natural. Natural means it comes from a soy derivative. Natural in the case of progesterone and testosterone. It means it will come from, let's say, a Mexican yam. That's natural. Bioidentical means it's in the correct ratio of a human, not of a horse. We used to have conjugated estrogens years ago, but they were in the order pretty much of a horse. You know, the female is not a horse. She is one who deserves to get exactly what she needs. So bioidentical means in that order, and they can compound it. But I started to tell you, which I think is important, we only know and use pretty much 3 estrogens, the ones that are prominent: E1, E2, E3, estrone, estradiol, and estriol. But what women are not aware, the women have in their body, men too, about 20 different estrogens. We're just not overly familiar, nor is the research said, oh, these over here may be as good. So when we do it, we try to be as close to what the human needs and as close to what that particular individual requires, for all the things that we talked about before.
And what about testosterone for women?
Important. No different than a man. You know, some say, oh, that's a female, that's a male hormone. That is a misnomer. It's not true at all. We all have every single one of the sex hormones: estrogen, progesterone, and testosterone. Men and women. We have it in different ratios. Like a female typically has 1/10 of what a male has in testosterone. But you have to think, how did God build us? So there's a receptor from head to toe for estrogen, progesterone, and testosterone. It's not just for sex. Why would you? God put it in our head. It actually allows for intercellular communication. Cells can't talk well without having the normal healthy levels of a young person, in this case, a young woman, their hormones. So we try to rebuild that and keep that relationship. Testosterone, of course. What's testosterone for a male is the same for a female, just it needs lesser dose. It's our waking up in the morning with that, joie de vivre, that thirst for life. As a matter of fact, if you talk to a lot of men and you replace their testosterone a little bit later in life, 60s, 70s, their biggest thing is everyone thinks, oh, it's their libido so good they want sex 15 times a day. It's not. It's that they say they wake up with that feeling of being a young man again, that purposeful thing, which is extremely important. And the woman itself, also the same. She sleeps better. She thinks better. She's stronger. She's more alert. Yes, and yes, libido. And I put that last in both cases because I don't want people listening to the podcast to come say, oh, testosterone for women just because, she wants a better libido. That's not true. It's for good cellular communication. If you can think that all pretty much our 30 to 37 trillion cells are talking to each other, part of that communication is estrogen, testosterone, and progesterone. You recognize how important it is for everyone.
Now, are most people being prescribed all 3? Estrogen, testosterone, or progesterone all together? Or is it a kind of a combination of maybe 2 of them, or?
It depends on the individual. So I'll try to answer it because the answer mostly should be yes, because usually one falls off the other. Well, typically a woman begins to lose her very first hormone in her 30s. That happens to be progesterone. That's why she doesn't sleep as good, because progesterone is a precursor to the neuroinhibitory hormone gamma-aminobutyric acid. So as you get older, you start to lose progesterone. You don't sleep as well. But here's how it works. If a woman's having symptomatology and you're putting back, for example, estrogen in whatever combination, and we can talk about it if you ever want, but if you're putting that back, I think it's incumbent on the healthcare practitioner, the doctor that's putting it back, he or she must supply progesterone as well. Now, once in a while, you'll hear somebody, maybe a gynecologist, oh, you don't need it. Your uterus is out. That's not true, because cardiovascular health in a woman also is dependent upon good progesterone levels. So as estrogen is proliferative, makes things grow, it's progesterone that says, not so fast. Take it easy. So before I would prescribe either estrogen and progesterone, I always do not only a blood workup, but I'll send that woman for a pelvic ultrasound, both transabdominal and intravaginally, because I want to see, is the thickness of that uterus an issue? If it is, then more progesterone should be given to that woman. If it's normal, then a little bit less, but always together. Now, do I give testosterone at the same time? Most of the time, once the ovaries begin to not produce as well as they used to and their estrogen's not being produced, progesterone, you're going to find that the testosterone is low too. And, there are many reasons. Some women, I don't want that, whatever. But for the most part, you should look at this as a family of hormones. And for most women, even if it's less of one, more of another, etc., done, of course, academically correctly, they should probably be prescribed all three simultaneously.
Yeah, why I think people are just, the perception of a woman taking testosterone is, oh, she must want to be a bodybuilder or, trying to build this massive muscle or something, or it's going to make her look like a man, right?
Not at all. Listen, I can tell you this, just for the libido component of it, every man listening to your podcast, give my wife, give her testosterone, I rub it on her feet at night, that kind of ridiculous stuff. It does increase interest. There's no question. The biggest thing about testosterone is it does increase interest, obviously, but it's not just strength. Women talk about they become osteopenic, osteoporotic as they get older. Do you know that those three hormones are required for a good, strong bone? Testosterone strengthens bone. It does strengthen muscle. You don't have to work out to need it. If you just want to feel the way you did youthful, I always say, look, where do you want to be? You want to be normal? Or do you want to be optimal? And I'll say that often to a patient. Tell me what you want. Do you want to be like you were 35 or do you want to be like you're 75? Because you're normal for 75. I'll see you later. Bye. No, Dr. Mitch. I want to be like I'm young again. Then that's a very different thing. And the truth is, who's the healthiest? Who would you send to surgery the most? Who do you think feels the greatest in the morning? On average, is it the 18-year-old or the 84-year-old? I'm exaggerating, but the point is obvious.
What supplements do you recommend that support hormones and the hormone journey?
Well, first of all, they need something that allows the hormones to go into their proper pathways. I will say this out loud. If you get hormone replacement, regardless you're a man or a woman, and you're not given things to support the metabolic pathways, I would run from that particular practitioner. And the reason is, it's not hormones, and I'll divert just a second because it will make sense. It's not hormones that literally cause this cancer and everything. And even Maha now agrees, everyone pretty much agrees with it. And if you think, just in general, how were we made? And I say to people, well, when you were in high school, I'll sometimes be a little sarcastic. I'm going to take a piece of paper. Name me the women that had cancer of the breast at that time. Oh, you don't have anybody. Okay, so tell me, what are the men who had prostate cancer at that time? Oh, you don't know any either. And you don't. And figure the testosterone's the highest at that point, and the women's, their breast is growing, they're becoming women, their estrogen is high. It's not that. It's where does that estrogen eventually go through metabolites and also the testosterone. So things like saw palmetto to make sure. See, testosterone, for example, we can use that if it's okay with you. It'll stay either as testosterone. It will convert through a pathway called the 5-alpha reductase pathway to DHT, dihydrotestosterone. And you need it. That's what gives you that good feeling and libido, etc. But too much, you'll lose your hair. You get acne. You'll get clitoral enlargement. And then the other pathway, if it doesn't stay as testosterone, it can go through what's called aromatase pathway, much more aggressive for men after they're 50, and it becomes an estrogen. Matter of fact, many men after the age of 50, a good majority, have as much estrogen as a woman that's menstruating. So we want to make sure those pathways are going to the correct areas. And if they are becoming estrogen, are they becoming E2? Because E2 estriol, normally produced mostly in pregnancy, actually is protective. It's protective of breast cancer. Are we making 4 and 16, estrone 4 and 16, which are more aggressive for creating maybe a breast tumor? And that ratio is extremely important. Practitioners need to think about that. And if I at least impart that, nothing else in this whole podcast to the women that are listening, if someone has not taken the time to supply you with a proper way of taking these metabolites into non-aggressive and proliferative pathways, shame on them. Get another doctor. They should know better. So you were asking about these things. Testosterone is not something that should be just walked away from. It's great for everyone. It's great for a woman. The combination is, can you feel the way you felt when you were younger? And the answer is yes. It's not just hormones, by the way. That's one piece of this wheel. But if you want to make a wheel, you want to make sure all the cogs are in place. And this is one of the cogs in the wheel. And so by the time someone begins to break off, I believe they should look for a good, functional, integrative healthcare practitioner, doctor, PA, someone who can lead them, monitor them, and help them, because Alzheimer's disease is much lower in women who start replacement before 5 years. The bone stays stronger. Their cardiac situation stays stronger. It goes on and on. So yes, it makes sense to do it all. Did I answer your question?
Yeah, you did. And a lot of benefits to it. But I think, for a while there it was so controversial. People saying, oh, it's going to give you cancer, certain types of cancer. Those were like a cluster of studies that talked about hormone replacement in a negative light. How did that affect your practice and what you were thinking at that time?
Well, it might have affected a patient who was scared, but in general, never affected the way I thought, nor philosophically either, nor scientifically. Those were originally done on what we started to talk about earlier in the podcast. They were done on conjugated estrogens, and they were done where they were unopposed. So conjugated estrogens, from horses that were kept standing, never let lie down, stressed out. Their estrogens are different than a female, so they're not bioidentical. We didn't use progesterone to offset the effects of the estrogen. So yeah, that would have been a problem, and I wouldn't have done it. But in today's day and age, with the natural bioidentical components that we have, it's like saying you shouldn't be youthful anymore. I always go logical when I talk to someone. I'll say to someone, it's up to you. You don't have to. And I even hear people say, well, if God wanted me youthful, I'd have it long. I said, yes, yeah, you're right. But if you want to look at Sarah and Yocheved, Moses' mother, they had children in their 90s and 130. Why do you think that occurred? Because they ate properly. They didn't have the pollution in the air. They didn't have the things the insults that we have to have every day, that when we live in this world, what we breathe, what we put on, and all the things of that nature. So with that knowledge in hand, doesn't it make sense that if we were supposed to keep normal, healthy interaction of cells, and part of that is using hormones, why aren't we doing that? And that's the key. We should be doing it regularly.
Okay. Let's talk about sexual wellness
as
a pillar of health.
Okay.
I saw some videos of you talking about it, and I think it's very important because we don't talk about it. And that actually supports the hormones as well.
It sure does.
Having sex.
Yeah, it does. I'm glad you brought that up. I'm never afraid of that topic. I like it. And neither should any healthcare practitioner talking to their either male or female patient. They should talk about regularly. My motto for the longest amount of years was look good, feel good, and have great sex. I used to get up in front of a crowd, even lay crowd, and say, my motto is look good, feel good, have great sex. And if anyone in here thinks one of those is not true, you're lying. So it would be that. Well, of course, sex, there's a reason for it. Procreation of the race, of course, is why we have sex, but it also has so many wonderful things. The very first is it feels good. And I think that's okay. There's nothing wrong with that. It causes a closeness to your family. I mean, I can't tell you that I don't like having sex. I love having sex with my wife. I tell her all sorts of things that you should do it every day, 20 times a day. She thinks I'm nuts. She's a nurse practitioner. You want to hear a funny story? This reminds me. I came home one day and said, sweetheart, look at this. There's an article that says the more sex you have, the healthier you are. She says, give me that article. She's a nurse practitioner. She says, it says here, if you have sex 3 times a week, it's good for you, but too much could actually turn down the immune system. So now I have to think quickly. So I said, you know what? Let's just do it every day until I get a sniffle. Then we'll stop.
That's amazing.
So it It has so many wonderful things. For both sexes, it increases the anabolic steroid called DHEA. It's the number one circulating steroid in the human body, dehydroepiandrosterone. It is the steroid of youth. When we measure youth, we talk about an anabolic state where wear and tear is much less than repair and restoration. That's the key. That breaks off that number from the time you're 30, 31 onward to about 10% per decade. But guess what? It's reproduced, it's increased during sex. You give off oxytocin during climax. The oxytocin gives you that cuddle effect, that love hormone. It makes people feel good. And people, by the way, who have like fibromyalgia, ask them, when you have a climax, does it go away? Do you know most of the time they'll say, you know what, Mitch? Yeah, it does. And I'll prescribe them this oxytocin regularly, to take because it does help with pain relief. And for men, you're literally getting rid of the carcinogens in the prostate. The prostate, it raises citrate and it helps get rid of it. The things that help stop cancer in that prostate. There's actually a study I read once, if I'm off a little bit, oh well, but it said those men that have the highest testosterone and ejaculate 21 or more times a month, they actually have the lowest prostate cancer risk.
Wow.
Use it or lose it. No.
Now, is that self-pleasure too? Can they be?
Oh, yeah, it will. You will. Masturbate. If they masturbate, they empty that prostate, they're getting the same thing. They may not get that security, the love, obviously that effect, but it's still emptying that prostate. And that prostate, like the vagina, are self-cleaning ovens. Gynecologists used to use this expression when I went to medical school. A vagina is a self-cleaning oven. It goes out. You don't have to douche and things. 99% of the time, it cleans itself. Well, believe it or not, the prostate's similar. If it's emptied, you're getting rid of these carcinogens. You're decreasing your blood pressure. You're decreasing your cortisol level. You're decreasing your stress, and you sleep better. So is there a reason for sex, and should you? Yes.
What is the prescription? Is there an amount? You said 21 times a month.
That's a lot, right?
Yeah, that's kind of a lot.
It's
so
a lot.
Is that the
I think the,
benchmark?
Well, you have to look at, pretty much, look, when you first meet someone, you have that, one of the things in the area of the brain where dopamine is released and you have that love component is a yearning for that person. Part of that yearning is you want to be close, you want to have sex. And that could be in the beginning, if you just live together and move together, that could be every day, sometimes maybe more so on the weekend. I think overall, I would say for health, I would say probably minimally 3 times a week, but there's nothing wrong with daily if that's what the couple chooses. 20% of 80-year-olds, or 30% even, I'm not sure the exact statistic, but it's that high, still have sex 3 times a week with wives. And you know what? What is the one thing that keeps us alive? You can ask me every question, every vitamin, every mineral. But the Harvard study, the longest running study of men, the Harvard Men study, shows that it's that social interaction, having a friend, having people that you could trust, having someone you could talk to. And so if you have that interaction and you add this, like anything, like I say, marriage and a relationship, sex is the icing on the cake. It shouldn't be ignored. You should talk about it. But the reason even more so is it also maintains that relationship. There are 2 things that really break a relationship and cause divorce in this country. One's financial, and the other is a change or divergence in sex. Suddenly one of the mates go, I don't want to do it anymore. Or, it's one thing if they become sick or something. I'm not talking about that. But, you started off at one point and it goes to another. So did you discuss it? Did you look into it? Did you go to healthcare practitioners? Did you check your hormones? And did you try to work on this? Because it is that component. I remember once I was lecturing, I lecture readily, and I was asked to lecture at a addiction conference. Oh yeah, what's my topic? Sex addiction. I said, what? So that's what it was. But I think it is an integral part. It's not everything, of course, but it's an integral part of our life. And it has so many wonderful biochemical changes that occur within the human and within the woman that it should not be ignored for any reason.
Yeah, I agree with you. I think sometimes you don't feel like doing it, right?
Of course.
You don't feel like doing it. But there's never a time where I'm like, oh, I wish I didn't do that after the fact. You feel good.
And by the way, that's normal, Kimberly. Look, you work hard, you come home. Your husband works hard, he comes home. The kid's driving you crazy. Someone at work said something, you're not in the mood. So that's the time when I like, for example, to sit and talk to my wife. I want her support. I want to talk to her, talk to someone, who is a compadre that I can listen to, and they can listen to me and help me. I may not want to have sex that night. It's okay. It doesn't have to be a hard, fast rule. It's 3 times a week every night. It should be something that's looked at that is not only a enjoyable thing, but it is part of your normal healthcare. We talk about all these other things. I do this, I drink water, I run 15,000 miles. Yeah, but you'd have to also have that as a component. That's the way it should be looked at. Another, like we said earlier, cog in the wheel of health.
Yeah, absolutely. Absolutely. We're all doing all this biohacking and sitting under red lights, and maybe it's simpler than that. Maybe it's just having some sex.
It is simpler than that. Nowadays, because of the podcasts, which are wonderful, and because of the internet and all these things. And, I have a daughter who's extremely famous. She has 17 million across all her platforms. The truth is, people listen to these people and they think that what they have to say is correct. So they give themselves titles. They're an expert in nutrition. They're a biohacker. I have no clue what that means. But the truth is, people beware, eyes wide open. Remember, these are people just putting themselves up as something that they are experts in a field. It's not necessarily true. There's something much more deeper that you need to do that probably we'll get into as we go along.
Yeah, so true. Well, let's talk about IV therapy, because you were one of the visionaries in that field. What do you think about these IV drip places kind of popping up on every corner now?
Yeah, first I'll give you a 2-minute background. I think the folks watching or listening should know. Now when I get up to speak, I'm called the old OG. The old original gangster. When they first told me that, I thought they were cursing at me on the air. I'm thinking, what are you saying? I'm the dinosaur in the IV nutritional field. There was one group that was before me. Unfortunately, I think most of them are gone. I carry the mantle of that now. I speak readily. I've trained over 4,000 doctors. This year, I'm speaking to over 1,500 in this space. And I've written the only textbook on intravenous nutrition for physicians. So I occupy that space, and people come to me for the issues and how to do it. You asked a very important question. I'm going to answer this nicely, but also with a similar caution that I did with the other answer that I gave on the hormones. And that is, if you think you can walk into a place and pick out what you need for IV, both you and the person giving it are not very bright. Sorry. And even though it is vitamins, how do you know what you need? How do you know what your body needs? You give your body too much of a specific nutrient, you can do harm. You give it too little, you won't have enough. So there's a way of knowing. So the proper way is always understanding a few things about that human being. And the one that I'll focus on now is at minimum some amount of their biochemistry. You and I are different. Amber's different. We're different. I'm sorry. No matter if you live on the same block, you're on the same cheatery table, and you do everything, we're different. We're well over, and I don't know if this figure's correct, but it's true. Trillions of chemical reactions per second. So how in the world could A be the same as B, C, and D? It is not. So if you're going to take an IV, then you should have at least a minimal idea of how's your kidneys functioning, how's your liver functioning, is your blood count okay, do you have enough magnesium, do you not have enough zinc in your system, do you have a few of the things that make a difference to which IV you should take. Now, I was recently on, I think it was NBC, and I said, how ridiculous to go into a place and pick out, this was about peptides, but to pick out something like that. I said, would you go into a pharmacy, and I'll use the same example, it's worthy of it, and pick out your chemotherapy. Right. Now, people will say, what are you, crazy? Yeah. Okay, well, would you pick out the antibiotic you needed for your infection? Would you pick out the drug you needed for an autoimmune disease? How do you know, even though it's vitamins, what you need if you don't know your background? And you can do that with any profession. I asked someone who's a car mechanic. Oh, listen, I have this little noise in my thing. I think it's this. So can I just get you to change the carburetor or something? And they look, and a car's only 2,200 moving parts. We're hundreds of trillions of moving parts per second. So how do we make that? How do we do that? So how do I feel about them? I think if they do at least do some minimal blood work, it is prescribed by a healthcare practitioner, nurse practitioner, PA, physician, someone who has a prescribing license. It's important. But you know what? Yesterday in the New York Post, whole article about New York and all these med spas popping out. And they do because there are lay people that are buying these things. They see it as a potential income thing, open 30 of them and all that. I have great reservation in those cases. I think if you want to be healthy long term, the guesswork is not going to be helpful. If you're dehydrated, you drank the night before, if you want to go get a hydration like lactated ringers, okay. But if you have a specific biochemical abnormality, you have a specific disorder, I think that needs to be seen by someone that absolutely knows what they're doing, understands your biochemistry, your physiology, and what we call your biological terrain.
The same can be said for the hormones too, because these med spas are giving testosterone and testosterone shots. And how do you have any concept of what that person's background is?
You don't. And not only that, but, I've interviewed recently nurse practitioners who work at spas that they give peptides like it's water.
Peptides
40
too, yeah.
people a day. Now, she told me, look, we buy the peptide. Now, I get it. The owner's not a doctor. She's a nurse practitioner. We get $75. We pay for that peptide. We sell it for about $500. Now, you do 40 of those a day? I don't think the math makes anyone not understand what's going on.
Right.
But is that really okay for you? Is that safe for you? Is that good for you? And of course, you'll get people, again, in the industry, on the whatever, going, yes, it's great and all that. But you know what? As often someone calls me, like your friend Emily, I'm the contrarian, so to speak. It's not that. I think everyone thing has its place, everything. But make it right for that particular individual. There's no always or never, no more than that one shoe that fits everybody.
Which longevity trend is complete nonsense? There's so many trends out there in wellness.
Oh my gosh, I could go through so many of them. And I guess I will start by the general statement. The longevity trend that's nonsense is the one that doesn't fit your biochemistry, your physiology, and what's going on inside you. With that being said, I'll give you a perfect example. I am the chief medical officer for Hulight USA. They bring the best Korean equipment in the world. It's a infrared light is one of them, hydrogen's another. Their equipment is really spectacular. It's made properly and used in the right person for the right time. It's excellent. So you can go on anytime and you can hear about these hydrogen water tablets and stuff. And they're really cute because some of them, the glass turns blue and kind of neat.
Yeah.
But they don't match anything anywhere close. And as a matter of fact, even drinking one of them, if you take it by inhalation, like 2,100 cc's, with which the machine we have, my wife and I, we leave it at our house when we watch TV. I'll use it a half hour, she does. You're talking thousands of glasses to try to get to the same amount in the general circulation. Now, if you're using it because it's just a fad trend, that's absolutely not a good reason to use it. If you're using it with the knowledge that hydrogen is the smallest molecule in the universe, it's the universal molecule, it helps creation, it helps fix things, it definitely improves two of the major antioxidants in the system, it gets you to be healthy, and most people have way too much oxidation from what they eat and everything, then it makes sense. But that type of thing, I can't say that all of them are terrible, but the truth is, you don't know because you've not been tested properly. So you're just getting these things. They sound good. They're gimmicky. And the people talking, anybody that's talking about something and suddenly says, oh, yes, and I do myself and raise it up and I'm putting, they're pushing a product. It's a fad. It's not for me. And I would also tell my patients, it's really not for you. Why don't we really figure out who you are? What's your biochemical individuality? That's all that matters.
Are you relying heavily on blood work, or are there other things that you do?
So I do it in 3 areas, and that's an amazing question. Thank you, Kimberly. One is we were talking about person's individual biochemistry. The typical is going to an internist family medicine. They'll do 10, 20 tests, CBC, complete metabolic profile, maybe your thyroid profile. Now I say, okay, years ago, I'm much older than you. So when they took a car in, well, they looked under the hood, they took the air filter, they changed it, they oil and lube the car, they slammed it closed, they said it's fine. Nowadays, you take a modern car in, they hook it up to 150 check on the computer. I like to see myself, or make the analogy that I'm the 150 check person. So we can't know all those trillions of reactions per second. If every doctor in the earth sat around, we wouldn't know 1 second of your life in 50 years. But what we can do is get enough in the different areas, the hormones, as you were talking about, but the majority of hormones, your thyroid, your inflammatory markers, your intracellular minerals like zinc and magnesium we're starting to talk about, other inflammatory things that we can tell where maybe the breakdown metabolically is. So that's step one. So I'll do 130, 150 tests. The patient goes to the lab. Yeah, they're going to draw 23 tubes. Oh, well, oh, well. That's what I tell them. If we draw it in the office, we do it in 11 most of the time. People say, why is that? I said, because when you go to a lab, the lab technician doing his or her job, for each test, they pull 1 tube. We know that we can get 5 tests out of 1 tube, so it's less. But even still, that's the way of beginning to know your biochemistry. Now, that's not enough. The second step is to know your physiology. how do you function? Because the biochemistry is one, the physiology is two. I always look at someone's physiology through the eyes of an ANS. That stands for autonomic nervous system. Everything that's done for you that you do not do consciously is the ANS. Blood flow through your heart, sweating, blood pressure, liver function, digestion. 9 out of 10 diseases that will kill humankind in the United States either initiate or they complete in the autonomic nervous system. Not only that, we know now that heart disease is related to it. Newest studies in the past 2 years, even cardiologists often don't know that. It's all this dysautonomia, this system that we were provided that you know as the fight or flight. Now, fight or flight should be on when you need it. You see a cat, something falls, go. But it's off. And every animal on the earth has this system, the sympathetic to get going, which starts everything, and the parasympathetic says, you're fine. So we test that to see where that, because that gives so much information about the functionality. So many people, it tells me about coronary artery disease. It tells me if they have very tiny microcirculation disease with pretty much there's nothing in the armamentarium of the cardiologist or family doctor, internist to work on. It tells me about whether you're uptight, if you have that lion chasing you all the time. And lastly, I do one other thing that for me makes a difference altogether that no one ever thinks of. And that is, I think back to the 17th century. In the 17th century, the fair-haired boy of the French Medical Society was Louis Pasteur, you know, the father of the germ theory. But the father of physiology was Claude Bernard. And he said, everything's about the terrain. Now, they say it's legend, probably, I don't know if it's true, that Pasteur on his deathbed said, Bernard's correct, it's about the terrain. But I'll help you think of this. When you go to your practitioner and there's an abnormal blood test, we are typically, and then most doctors, are reactive to it. Okay, you got this, oh, let's give you something for it. But something in the soup of your body, how your cells are working together, that mixture, the chemistry, the metabolic systems, start that before that ever happens. And so if you don't look for it, you don't really get to the underlying thing. A simple one that you hear a lot is that, for example, a cancer patient, they're often acetic. Now, all cells are acetic inside, but it's more than that, a lot more acetic. So what happens? How does that occur? What are the things you could do to eliminate that soup that I look at? So I get a total picture of someone, and I tell them, look, when you come in to see me next time, I'll know more about you than you know about yourself. And we'll sit down with you and your family or whoever, and we'll go through the cases. And then we'll fix these things. We'll cement the holes. That's why people get better. That's why they can have longevity. And that's how they can be optimally healthy.
How are you testing the nervous system?
The ANS is a non-invasive test. The algorithms are typically from major schools. It's been around for so long. I don't know if you'll remember, but when you had your child, they hook you up to a monitor. That monitor was telling them whether that baby's okay. Do you know that's an ANS monitor?
Oh, interesting. Okay.
1960s was the first of it. It was perfected even further in the 70s. We've added and bolted on other tests to it. So it's not something that's, it's just in an alternative medical journal or something ridiculous. It is a serious eval. So it's just easy. It's a couple wrist straps. It's a little receptor on the finger, couple straps on the ankles, and 2 pads on the feet. And within about 20 minutes and doing a few simple things, breathing, standing, holding your breath, pushing down, the amount of information is so invaluable. You know so much about that individual. And it makes sense because then it's not just about your chemistry by doing a lot of blood tests. It's also about what's your physiology? How are you functioning?
You could have really great blood work on paper and be stressed out, or you could be vice versa. You don't look so great on paper, which I think is how I am. I don't look that great on paper, but I function at a high level. You know, I feel good. I exercise, I dance, I do a lot of stuff.
Exactly. And that's great. And you have to think, look at a farmer. What does a farmer do? Does he or she wait until the weeds grow? No, they check the soil because they know often, and this happens often in medicine, function precedes structural problems. You know, all the tests, the CT scans and the CAT scans and the PET scans and the MRIs. Well, they're late in the game. When you see something, 90% of the time, and don't quote me on that figure, but it's a high percentage that people have already had that function going bad. And that's why they grow something. It just doesn't show up as a colon tumor or a breast tumor. Something's wrong in that biochemistry and in that biological trend we just talked about that has led itself to suddenly developing something they can see. You can't see anything till like it's 0.4 to 1 centimeter. Do you know that there are tests that we can pick up even tumor cells in blood months to years before you actually can see an actual tumor? And too many people are on the if then. You know, doctors are trained. We're trained in medical school. If you get something, here's the cure. Or if you get this, here's that. Everything's if then. Yeah, and I left that behind a long time ago. And for me, it is, what's that person's makeup? How do I fix that makeup so in 10 years she's still my patient? That's what I do.
I want to talk about mold, Lyme, viruses, Epstein Barr, whether it's mold exposure, Lyme disease, Epstein Barr, heavy metals, hormones, or nutrient deficiencies. How do you determine which one is actually driving the illness?
Oh, I think that's great. Hopefully we have 5 hours for this podcast. But
I hope.
I'm going to try to be as succinct as possible because I want your listeners to really understand. You hit on a very good point. The answer is you need to get out of that thought process. Let me reframe everyone listening. The Americans, not so much the Easterners, but the Americans, Western medicine is often thought, and it helps us think, one thing always leads to another. If you have a sore throat and it's strep, we give you an antibiotic. It's not how the body works. The body, because of all those trillion chemical reactions, A goes not just to B, it goes to Z to X to Y to B, then B goes to F to C, and it goes all over the place. And it's a circumstance of many things. So, for example, let's say you have the things you said. You have EBV, you have mold, and by the way, in Florida, it's not that you have mold, it's a matter of how much. Sorry, where we live here, it is. And it is for any of the wet, damp places that people live. It's not a matter whether you have toxic metals. Every human on earth has toxic metals. And I'm, again, the OG of that. That's what I teach and be teaching a lot this year. So we all have them. So all of them do damage in different areas. Every time you pick up a cup, if you drink, and it's not like a nice cup that Amber was nice to get me with my coffee, she put it in a styrofoam cup, you're getting styrene in your system, you're getting plastics. Then in the same question, if there's anything plastic, maybe like this thing around the microphone, I'm breathing in those plastics too. Then I have in the air the toxic metals. So it is a combine. It's never just one thing. Could one thing cause an issue? Of course. Can you give me an example, Mitch? Yeah, I will. See, I'm doing both sides of the conversation now.
You're doing my job. I love it. I'm okay with it.
I don't need to do that. But Kimberly, this is what happened. I'll give you an example. You're exposed to a massive amount of mercury. You played with it. You're playing with it. Kids are playing with it. For whatever reason, stupid reason. They could have an acute exposure. They will have acute symptoms. But most disease in this world today is you played with a little bit a while ago. You shoot guns with your lead jacket. You have a little bit of that. You use aluminum pots. So you have a little bit of that. You're using still Teflon in it. And it goes on and on. You breathe in and so forth. So you asked a great question.
These are the things that make me spiral.
They will.
Yeah, thinking about all of it.
And you shouldn't spiral.
Okay.
Because the bottom line to all this is one thing. Are the cells working healthy? Now, if they're not, the very first thing for the things that you gave, outside the viruses, of course, is to avoid them. You substitute things. So my website is GhenMed, my last name, GHENmed.com. And we have like this 30-day program that everyone pretty much should do. And one of the parts of this program is each day, let's substitute. So instead of using your pot, to give you an example, your Teflon, let's get one that's titanium, do something, let's exchange things that you're doing. Instead
your plastic Tupperware.
Exactly.
Go to glass. Yeah.
Exactly. Don't drink water out of a plastic container. Get yourself a reverse osmosis system and fill it up. So it's worthy checking into and doing, just to give myself a plug over that. But the truth is, we have to make substitutions and we have to do avoidance first. To tell someone I'm going to do something about getting rid of toxic metals and you're still putting it in your system makes no sense. I tell people, what good is it if I'm taking something out of the tank and you're putting it in simultaneously? I said, it will get somewhat better, but you got to work with me. This is not a one-way street. Doctor does all. That's what people expect from their doctors. Oh, you have blood pressure, take this. Well, it doesn't work like that at all. And that's a discussion maybe for later or for another time. So what I do is I create that avoidance pattern. I look for all the potentials. How do I find these things? Well, you could do a toxic metal test. It's an easy test to do. It's a urine test. We use a challenging agent like zeolite, which will easily pull it out. You want to know about mycotoxins? There's a test for mycotoxins. No problem. It's easy to find. You want to know whether you have EBV, for example? Well, everyone's had EBV. If you're over 40, don't bother testing. You had it. 95% of the earth has had it. The little girl in China that's now 40 years old in northern China, she's had it. It's the end of discussion. Herpes viruses are ubiquitous. They're everywhere. The question is, it's an oncovirus. And it does, when it's one of the 8 viruses that can cause cancer. EBV can cause leukemia or lymphoma. So you want to know if you have EBV, if it's recrudescent. Did it come back? And we have a test called the EBV early antibody, the D antibody. If that's up, then you're reproducing right now in the bloodstream again, or you never stopped from the time you had it. That's more important to me than you had it, because everyone's had it. And those are the things that I look for when I start doing my investigation into that physiology and that biochemistry. Now, at the end, I then correlate. Could that biochemistry of Kimberly be off here because she has toxic metals here, or maybe because she has myco? So how do I correct all of them in the best way fashion? So that's when treatments are put on top of each other to create the perfect thing and get that up. Again, I've said it several times. I say it again, optimal health. Normal health or feeling good is not good enough. There are people loaded with cancer, feel great. There are people that have very high blood sugar, feel great. That doesn't mean they're healthy. So the idea is, can I prove eventually their biochemistry, their biological terrain, and their physiology are improving, functioning? Of course I can, because I can look at what I started, the benchmark, and say, okay, Kimberly, in 4 months, I'm going to take another look at you. And then she and me and whatever other patient we can see that there's a difference. And then it becomes obvious, my energy's better and this and that. It's a multifactorial way of doing things. All those things, we can certainly talk about them individually. I'm comfortable doing that. It's just that all of them should be considered between the history and the physical, so you know what tests are appropriate to get.
Yeah, I asked, more personally, because I have tested for mold. I have tested for Epstein Barr. I had an active Epstein Barr reactivation. I think after childbirth, which was extremely stressful, I had kind of intense experience. So I think that's kind of maybe when it resurfaced. But, where someone does have mold and they all feed each other, right? So the mold and the heavy metals and the parasites and the virus, and they're all kind of interwoven, right? You start with one. Say somebody has all of those.
No, I start with all. Maybe less in one category opposed to the other. I always diagnose 360 degrees. I treat 360 degrees because you want to allow the cells to work the way God put them in your body and work properly. By the way, you are absolutely right. When I look at my cancer patients that are quite ill, almost 85%, and I've done this one hundreds of patients, their EBV is reinactivated. Why? Because EBV, which is a virus, the body constantly has to say, stay right there. Don't move, stay right there. And the minute the body is now confused or on to fighting cancer or whatever it's doing, the EBV starts to grow again. So you have to decide, is that something we need to fight immediately? And the answer is you can, and we can go after these things. There are things to go after. What I try to do is use things that can overlap. I give you an example. You said you had mold and you have toxic metals, right? So let's just say those two categories for a second. So I think, what can I do for Kimberly that will overlap both categories well? Well, guess what? There is a thing that I use from a biochemist. I make all my own nutrients. I shouldn't say all, but about 85% of them. My wife and I, we've taken a year for each one with research plus my own clinical acumen in that picture. And we found, for example, we use something called advanced zeolite. It's the person who makes it is in Boca, has a huge plant, and he owns the intellectual property on it. So it's the best. It's the cleanest, and there's all reasons for another time maybe to discuss. But I make sure I take it every day, and I take it because I know I have mold toxicity. The mold itself, you're just not going to live here without having it. It's the mycotoxins, the byproducts of the molds are a problem. Guess what? Zeolite removes. What about the toxic metals? Again, we're going to try to avoid all this like we talked about. Guess what? Toxic metals removed. Oh, wait, what else can the advanced zeolite do? Well, it can get rid of microplastics, but it also gets rid of something nothing else does that they've seen in 5 studies, the nanoplastics. The microplastics are only 1 micron. They do tissue damage, there's no question. They're in everything, but 1 micron, to give people just an idea how small, it's about 1/25,000th of an inch. Now, taking that, the nanoplastics are a billionth of a meter basic. They're really small. So these get into the systems just as well, a different way, but they're ubiquitous. And I've lectured on this not that long ago to the postdoc pharmacists. They're in the valleys, they're on the top of the mountains. You're not getting away from it. Nowhere you are.
Nanoplastic.
You're not getting away. It's everywhere. So the idea is, what can we do to take it out? Again, the advanced zeolite removes those toxins they found, at least in the water system. And there's good articles say that they now, have there been a major study? No, because no pharmaceutical industry has any interest in it, makes no money for them. But the articles are there. It is at least compelling to look at, and should be looked at. And then look at the VOCs in the paint, the volatile organic compounds. Guess what? Zeolite removes it. What I'm trying to say is, so how would Dr. Mitch approach it? So I would say, you know what? Let's make sure that you avoid. Let's make sure your liver is functioning, because a lot of this is detoxification of liver. How do we do that, Mitch? Well, I'll use oral things to support it. I use maybe IV that support it. And then what else? Well, then I'll use something that to directly molecularly can basket it. Oh, that's the zeolite. Let's do that. That's how I build a 360 treatment plan.
How do we take the zeolite?
Simple. It's a capsule.
As a capsule?
Yeah, easy. You pop a capsule once or twice a day, or 2 twice a day, depending on how much I believe of the issue is there. And it works fantastic. And then someone will say, of course, I'll just be the naysayer, the other side, because someone will say, well, won't it take out the good nutrients? I even had a doctor work for me once telling patients, don't take it. The nutrients, they were completely wrong. It's not true. Because they gave it to 10,000 sheep at one time, the zeolite, with their nutrients. Guess what it did? Because it cleaned out the cell, the nutrients got in even better.
Wow.
So you could take it together.
Okay, so we could all add that in to our protocol.
Oh, you should be. You should.
Okay.
I tell everyone, you can't, by me and by my wife, we're taking literally probably 40, 50 different supplements a day. We're using hydrogen. I even have the infrared bud of the Hue Light. It's 38,800 infrared, that in dome. I use it on my patients. I try to use that 3 times a week in the other. In my head, I have a specific reason, and I base it on our biochemistry. Well, everyone should do the same thing. Just don't take a word of whoever's calling themselves biohacker or whatever. Some are good, but the truth is, it doesn't matter. They don't know you. And unless you know the individuality, stop just listening to things and taking things ad infinitum. Find out who you are, biochemistry, find out your biological terrain, find out your physiology. Now, a good, cogent argument can be made for what you really need. And the results are that. And that's why the tough cases are what I see from all over the country. 10 doctors a month send me the patients that they can't handle because of just that. It's so much overwhelming information that, doing it so long, being in the space for over 44 years, I can help these patients. And that to me seems, that's why I get up in the morning and God goes, get to work, Mitchell. And I hope to work till I'm in my 90s. That's what I tell you.
I love that. Is there any common thread that you're seeing amongst those patients that have more complex cases?
Yeah. So is there a common thread? There is a common thread. We are, and I hate to use this word because I don't want people to tell me that they're detoxing. The common thread lies in pretty much 4 or 5 areas. One, and I used to call this the Ghen hypothesis after myself, but it's not that. It's that they're interconnected, mutually inclusive areas. One, you're not going to have health unless you have cellular health. Whatever that means, getting in the right nutrients, etc. Yeah, if you're missing magnesium, you're not going to be as healthy as the person who needs it. Okay, that's one. The second is intercellular communication, which you and I talked about, the hormones, to allow those cells to speak to each other. 3, there has to be some energy. The cells have energy. We have electrical current. That's why when I look for someone's biological terrain, I'm checking something called a phase angle. What's the electrical capability of that cell membrane? There's a thin membrane cell that encompasses all of your 37 trillion cells. If that's not healthy, that person's going to get cancer or something. And Otto Warburg, very smart a German Jewish physician in the 1930s. Apparently, the story goes Hitler let live because he was afraid of cancer. Everything he said still holds to today. It's been added onto, but his propositions and his theories, hypotheses hold. Then there is some sort of detoxification. I use that gingerly because what does that mean? Well, there are things that we can detoxify. We can get the toxic metals out, no question. We have methods to go and grab them out. We have chelating agents, meaning claw in Greek, to pull them out. But you're not going to detoxify, for example, some sort of insecticide, pesticide. We are exposed to them, fungicides. If you're not eating foods that don't have these things, you're getting them no matter what you do. And it's not just this. It's a little bit here, a little bit there. It's all the addition of things which causes a problem. And if you remind me, I'll tell you a story about that, which I think is interesting. And the last is this psycho-spiritualization. If you have one but not the other, you can have perfect nutrition, but you don't have good oxygenation, which is another one. Not enough oxygen, not going to live. You can have enough oxygen, not enough nutrition. You see, they're mutually inclusive. And the psycho-spiritual situation goes to that study we spoke about earlier, the Harvard's Men study, which basically is you have to have good day. And you and I both know, you can go up to someone, like Amber greeted me coming in, and she said, "Hi, how are you?" She was up and she's upbeat. But you've met lots of people that you meet that actually go, "Oh, yeah, I'm okay, Kimberly. It's not great." Do you know those folks have more chance of dying over the next 11 years than people that smoke 2 packs of cigarette a day? What you think is what you get. So there's no question that psychosocialization, that feeling good, knowing you feel good, get up in the middle of the night, makes sense. And to go back to that, which also will encompass the point you said before, I did a radio show once, long time ago, in North Carolina. I was talking about how apples have all these pesticides, and that a child, if they eat an apple a day, have 14 different pesticides, insecticides in their system at the end of the year. So folks, if you're sending your kids, make sure you watch it. It's organic. So a farmer calls me and says, "I don't agree with you. I have a farmer. I can't make enough doing the things. And you shouldn't be talking about, this insecticides. There's only a little bit on every apple and everything else." The good thing about being a host as you are, you get the last word. And on a radio station, you can go click and say what you got to say.
You can hang up.
Which went like this. I really appreciate your issue. I do. I know it's hard not to get a good crop, if you don't have this. But how dare you tell me that it's okay for my children, and I have 8 children, how dare you tell me that that's the problem? Because a little bit of your apple every day. But what about the person with the cereal that doesn't care and is a little something? Oh, yeah, and the person with the pear and this. So you could take your apple and you know what to do with it. So if that's what you want to do, that's fine. But for my kids, no, I'm going to try to protect them. That's a job of a parent to protect the kids. And that's how it went. Wasn't it really pleasant? But hey, you know what? Like I said, what you see is what you get.
Yeah. And you have 8 kids.
I have 8 kids. Yeah, we have 8 children total. And I have, I think it's 10 grandchildren now. I don't even know. Wow. Just don't ask me date of births. I have no, only one I know is the one that was born on January 1st, my granddaughter. Other than that, I have no clue what their date of birth
You'll
are.
never forget hers, though. That's
no, that's too easy for me. So
you have 3 ex-wives that all still work with you.
2 of my ex.
Okay, 2 of your exes.
2 of my ex. Well, 3, actually, if you're right. So my current wife, Irina, we work together in this genmed.com, and we do a lot of consulting for doctors. Doctors are lost in this space for the most part. They choose things, they go to a conference, and unfortunately choose inappropriately. But we're there. We try to help those. And when they have a tough case where they can't figure out, which is very often, I'm there. Even Access Labs, which is the #1 physiologic lab here in Jupiter.
Yes.
I'm their director of the consults, and I've been for 14 years. I talk to doctors, at least 40 every month, all across the country.
I had Adam on my podcast.
He's amazing.
Yeah.
Adam, I hope he doesn't get mad. These are brilliant guys. The father and mother I've known for a long time. After 14 years, I watched them grow up, okay?
Yeah.
And they're super smart, and they do a super great job. So, and I hope I said the right thing, boss. But anyway, but the thing also is that, my wife, that wife works with me. My 3rd ex-wife, Nancy, happens to be my partner. We were married 30 years. We're best friends still. I see her every day. I work with her. I talk to her. I see her every day. I'm in the office. She talks to the patient. She's amazing. And the other 2 don't work for me. One lives in Georgia. One is in Florida. But they don't talk to me. But I can tell you what I said one time to someone. Someone said to me once, "Dr. Mitch, are you good at what you do?" Now, I thought I was saying something pretty smart. But it turned out it wasn't that smart. But I said, well, how's this? My 4 wives, my present one, and my 3 ex-wives are all my patients. And she looked back, thought, and she looked at me and said, yes, but they get your services for free. And I said, yeah, you're right. I should change what I'm saying to people. But yes, I'm still really good at what I do.
No, I said, when, Emily said, oh, Dr. Mitch is such a special person. And then I read in your bio that your exes work for you. And I said, he must be pretty special. He must be.
You know what I've learned in this lifetime? I've been this way forever. I'm a people person. I first started off practice saying, I want to treat everyone like I would treat my mother. I miss my mom. I had her till I was 65, my dad till I was 62. That's amazing. But, sometimes I go, like when something special happens, like how I was on Newsmax and the New York Post and with you, sometimes go reach for the phone and say, Mom, So I always said you should treat your patients like they're your mother. Some are not easy, some are more difficult, but at the same time, they're sick. You need to approach that person with kindness, with real love for that individual and love for what you do. The only way you can do that is to take your time with an individual, really look into those 3 things we talked about, really understand that they are suffering. They came to me, and most come when they've been to a lot of other people first, and then apply the things that you've known. If you're angry, I tell doctors, go on a vacation. If you're angry and you come back, get out of practice. You need to be in a space where you're able to project something that the cup's half full. Too many doctors, as you know, will tell them, oh, it's just age, too bad. I never, ever, ever, ever say that to a patient. I have too many patients that come to me from all over the country, especially for cancer, because they're failing to the conventional treatment and they want to do the metabolic approach, or both, metabolic and chemo, which is fine, or whatever. And I always see the cup half full. I said, don't worry, we're going to really work on this. I give them that one thing that you have no right to take away from someone, and that's hope and faith. There's a mix to this. It's easy to say mind, body, spirit. I learned a long time ago that when you say that, you better really mean it. There is something about spirit. There's something greater than us in this. And even if you don't want to believe, I don't care what you call God, Jesus, Allah, whatever. It doesn't make any difference. As long as you know there's something greater and better than you that puts you on this earth and gives you the ability. I always tell my patient, with God's help, he's given me a great gift. I use it to make and help people. I'm just a vessel. And all together, the 3 of us are going to get you to be as healthy as possible. That's what I do.
Yeah, that's so special. Do we want to touch on fermented foods?
Yeah, fermented foods. Well, there's 3 topics. We can do that from pretty quickly. There's what we call probiotics. Everyone knows the good bacteria. And I have to tell you a good story about that years ago. I'm sorry I keep diverting, but it reminds me of things.
I like the stories.
Okay, good.
It's a podcast.
Yeah, okay. I like it too, Kimberly. Thank you for allowing me to be myself. So sometimes, when you do news, you have 10 seconds, you have just a sound bite. But it's nice to be able to tell people about things that you've experienced. And I have more stories. I could probably write a book that's 10,000 pages long from what I've seen in my career. So years ago, I was giving probiotics. Everyone takes a probiotic, knows it's important. It's part of the things you should take every day. So I say to somebody years ago, oh my gosh, this guy's such a quack. He's giving bacteria. And of course, in the last 2 years, the gastroenterologist's entire conventions are around the microbiome that's in the gut, the good bacteria. So, medicine sometimes, allopathic medicine takes time to catch up. So these things make sense. They're physiologically correct. They have good studies. You just have to be careful of how things are applied and not to, if you wait for everything, I tell people, you want to wait till your doctor catches up to this? It could be 40 years. Sure. You do what you want to do. I don't push anyone. I do what I think they should help. So the probiotics we know. The prebiotics is what sets up the gut. So the prebiotics sit like in pickles that I like. Kimchi I love. I don't always get it. Gotta love it, right?
I love it.
Cabbage that's spicy for those that don't. Korean cabbage that's very spicy. It's good. Sauerkraut. These things sort of set the bout. But I have to tell you, everything you eat is a prebiotic. You can eat a lot of meat today. Do you know the enzymes change in one day? Eat a lot of plant foods one day, the enzymes change. So every single thing that goes in your mouth is a prebiotic. So when you think about prebiotics and how important it is, you better think when you eat the candy that you're eating too, because it's changing that gut microbiome. And then there's something called postbiotics. It's the action of the probiotics on the prebiotics probiotics, which allow for like short-chain fatty acids and other molecular things like butyrate. It's like the number one short-chain fatty acid. It's actually the food for the colonocytes, for the colon to work properly. So all three work together. And yes, there's no question your neurologic, your transmitters come from the gut. A good portion of your immune system, Peyer's patches, comes from the gut. So when people say you should be fixing the gut originally, and we do have that in a 30-page, absolutely, you need to think about that, because like anything else, you want to fix your nose, you have to fix your gut too. It's got to do everything. So that's very important.
Very important. So how are you implementing fermented foods into your diet? Like, is there a certain time of day that's better to eat them, or, maybe a helping of sauerkraut or kimchi a day? Is that good? Are we still taking a probiotic in addition to that?
Oh yeah, okay. I always recommend part of the big 4 or 5 that you should always be taking. One of them definitely is a probiotic. Look, this is how it works. So probiotics are the good bacteria in the gut. There's maybe 400 to 500 different species of bacteria. The probiotics keep the negative ones from growing. It keeps them like, stay still, you're there, but you're okay. And here's what happens. So we go out to eat. We all love to go out to eat. Mm-hmm. So they give you whatever you get. Something that's made with water, whether it's orange juice, beer, I don't know. Well, if the water's chlorinated, you're killing all the good bacteria up top. A woman, after she's 40, 50, the majority don't have enough acid in their stomach anymore. The same symptoms for too much acid are the same as too little. So what do? They take something like to stop the acid, making it even more. Then you take a look at, you have lack of acid, you're not digesting properly, and then you're nervous and everything else. How do you fix it? You need to put back the probiotics into that system. And you talked about stress. Oh my gosh, stress is everything when it comes to good health. It is one of the pillars of good health. First, avoidance, like we said, of the foods that are really lousy for you. Mm-hmm. Then conscious eating. What am I putting in my mouth right now? Is it really going to do me any good, or is this a treat? It is how you eat 28 days of the month, not how you eat the other 2. So if you have a snack here and there, give yourself a treat, okay. But is the majority of time, are you eating these things? I think if you have it at least with one meal, and you take probiotics pretty much with 1 or 2 or 3 meals, depending on who you are, you can definitely check the gut bacteria and everything and how well it's doing by doing a test. It's called a CDSA, complete digestive stool analysis. It's like 48 things. It takes 3 weeks to do, and then you have a very good idea what's going on down there.
Poop tests.
Yeah. Do you digest?
Poop in a box.
There you go. It's poop in a box, and off it goes. But it's a physiologic test. It's telling you what's going on down there. A colonoscopy just looks for something that's grown already. Well, does that mean that physiologically what you have there can grow something bad? Because once it's there, it's there. I think you'd want to know what's happening functionally now, so that even if it's 1 year, 10 years, 12 years from now, if you leave it alone, you're not growing some sort of colon polyp or something. It's simply ignored by the conventional community, and certainly not by the functional root cause. It's all about, where's the root cause in this issue? Yeah. That's what we do.
So maybe poop test once a year.
Why not?
Why not?
I think it's a good idea.
Humble you real quick when
it certainly does.
You're scooping the poop out and putting it in the box.
Yeah, and you got to do it 3 days in a row, and I didn't send it yet because I know the whole story.
It's terrible. Okay, we're going to do a little rapid fire.
Does that mean I got to answer quick, or can I give a little bit?
You can give a little bit.
All right.
You can give a little bit.
But go fast.
And
go ahead.
say in or out.
Okay.
So in, you like it. Out, no, we don't need it.
Got it.
Okay.
Go.
Seed oils.
In if they're not adulterated, in if they're not esterified in smaller quantities, out if you're using esterified adulterated seed oils that are not in the refrigerator because they go rancid.
Oh, okay. So yeah, like fried foods at a restaurant.
Yeah.
Out.
But to take it out altogether because it's an omega-6 source is not fair. But in little amounts, we do have a lot of omega-6 in the cell membrane. That's where it all matters. So yeah, I would say with caution. But for the most part, you could put it in the out category because most people just take them and start using them and cooking with them. That would be out for me.
Okay, out. Red light therapy.
In or out. I use red light. I have it at home. If the way red light works is what is the frequency of that particular red light? What is the distance from you, the red light? And what's the illuminescence? That's what makes the joule force. How strong is that going? A good one, a really good one, like the one we were talking about, can go 1.9 inches into the system. It does what's called photobiomodulation. It helps the mitochondria that create all the energy to create more energy. Our energy exchange is called ATP, adenosine triphosphate. Is it in or out? If you're taking it off the internet, you're buying something there, someone told you it's great, it's out. If it's something that's really prescribed, you're doing it with something that's a professional unit that's really been looked at, like the Hewlett USA type of unit, it's in. So be careful. You know, there's lots of stuff you'll spend a lot of money on, doesn't necessarily mean it's going to do you any good whatsoever.
Not all created equal.
Nothing in this whole space is created equal.
Morning sunlight.
Oh, that's in. You know, you have to start your day with intention. One of the things that I talked about, as you saw in that article that was in Men's Journal, intention and focus. Get up and start the day. You should have that feel, that purpose that day. Go out, get sunshine. It resets the sleep-wake cycle. Take your glasses off. You don't have to look directly in the sun. Let normal sunlight enter your eyes. Do you know the infrared component, which is 40% of sunlight, is the highest in the early morning and late when the sun goes down? Why do you think I have animals on a farm? They don't get burned because they're out in the morning daylight. It preconditions their skin. They're not burned by the UV light. So start your day with a smile, with a joke. Stop looking at your stupid smartphone. Go outside, take some deep breaths, look around and say, hey, thank you, whoever you want to thank, but I'm here. And that's a great thing.
I love that. Cold plunges.
They could be in or out. You know, what are you trying to do? The whole idea of cold plunges or heat shock protein type of things, for some people, they like it. I can tell you this. I ain't getting in no freezing cold water in the morning. I don't care. I'm not doing it. So I don't have one in my house. Could it help in certain instances for pain? Oh, yeah. Wonderful. For people who have body aches and pain, it really does decrease pain. But is a fad, you know, and the fad with the guy who walked up Himalaya mountains with no shoes. I mean, there are certain things you have to take with a grain of salt. Yeah, I think if you want to try it one time, sure, go try it. Be careful because it is a jolt to that autonomic nervous system. Make sure you first have an ANS test done. And then if it's good and doctor says, yeah, or I would say, yeah, go, Kimberly, go try it one more time. I ain't helping you in that plunge. Go ahead. What else?
It's kind of out for me. I'm just
okay. It's out for me too.
I'm not a huge fan. NAD, either in IV or another way.
Well,
I guess.
and let me tell you about NAD+. NAD+, I happen to be the chief medical officer for the number one NAD company in the United States. NAD is like water. If you don't have it in your cells, you'll never produce energy. It's in every cell of the human body. Everyone. So if it's there, I go back to my original premise. Always I take it back to before we were created. Why was it put there? There's a reason. It has energy. Now, it does go down as we get older. If you're uptight, it goes down. It actually would go down if you have a heavy meal. It's used up just by a heavy meal. We have about 1,500, maybe 3,000 milligrams, I should say, a day. But it's in and out, used up, in and out. I actually developed a natural product orally for this company. It's their product, but I developed it. It's none other in the United States that looks at every pathway and makes sure that it reestablishes what you have. So NAD intravenously is very good for people who have real mitochondrial disorder, who are sick. I even sometimes use it in cancer. You have to be careful because some cancers use more NAD. Most don't. So that choice has to be made. It does help mitochondria to produce more energy. So in the right patient at the right time, similar to what I said before, it's great for filling up the tank, so to speak, even sub-Q that you could do at home for a short period of time. And then take these pills and you could take it ad infinitum. Now, if something happens, you're sick or whatever, that you need another fill up the tank because you used up your NAD type of thing, and you're sluggish or not, then maybe then you could use the sub-Q or intravenous again.
Okay. Sauna.
You're talking about like a sauna to get heat and sweaty,
Yes.
right?
Well, infrared or traditional. Which one do you like one more than the other?
Both will do similar. Okay. Both are relaxing. Both can help you sleep. Both take stress and take cortisol down. So I would say they're in. Be aware. A lot of people say, when I say infrared has 3 bands to it: near, mid, and far. The far band is the longest wavelength. That's what's in the saunas. And the far band, even though it's long wavelength, it hits the water molecule, vibrates it. That's what heats you, makes you sweat. It's not going to create photobiomodulation, not increase mitochondrial production of the energy exchange, the ATP. But it will make you feel good, will relax you. It's going to help you in general. Okay, so it's a good thing to have. One thing you must be careful of, if you have an infrared sauna, far infrared sauna, you have to know that the bands of our spectrum go from near infrared, mid infrared, far infrared. The very next thing after that is microcurrent. So if the manufacturers, and they're under no obligation to watch it, that I know unless new legislation is involved, they don't have to watch it. So you could be getting both the far infrared and it could be slipping into the cell phone. It's like sitting with a whole bunch of cell phones on talking at the same time. So I highly recommend, and I know I did too long on this rapid fire one, but I highly recommend getting yourself a Gauss meter, Gauss meter, let's say from Amazon, and, calibrate it, put it next to a cell phone. You'll see it's here. Then turn it on to like you're going to you'll say it go bzz, and do the same with your far infrared. If that needle's up here, I would throw it away. Now, like a steam sauna, no, that's okay. It's okay.
So interesting. I have not heard that anywhere. The
Well,
Gauss meter, we've got to do that. I mean, I've got to do that with my sauna.
Do it because unfortunately you may be disappointed.
Yeah.
Again, it's like anything else. If you're going to introduce to yourself, whether it's a vitamin, some sort of something that you do, some machine, anything, there's always a benefit versus a risk. Mm-hmm. The question is the benefit worth much more than the risk that's involved? And that's an answer that I provide all the time for the patient because they don't know.
Yeah.
They're listening to one side of the story. I always know both sides of the story. I learned that a long time ago. When I was 17, I was a Pennsylvania karate champion, believe it or not.
Wow.
I'd probably hurt myself if I did a kick now. But back then, I was really, really good. And my instructor, who was a really good guy, said something to me. He said, you know what, Mitchell? You need to know all sides of every single thing you do. You need to know if you're going to use a weapon, let's say a knife, you need to know the positive and the negative, or they'll never know. He says that will be your advantage. Because you're short, people underestimate you and you're extremely fast. That's their fault. But the idea is to know what is the positive, what is the negative. And I kept that in the back of my head and then to the forefront of my brain all the time when I start to treat someone. Yeah, I want you to go, well, wait, here's an issue. Be aware. Is it worth it? Well, let me think. I'll help you think about it.
I love that. I love
That's what we do.
thinking about that. We should all think that way.
Yes.
Okay, creatine.
Creatine is made in a laboratory. It's made by sarcosine and cyanamide. It's made by pressure, and those two. They are artificial. It's made in a thing. Just so you be aware, the liver makes it, the kidney makes it, a couple other organs make it as well. If you eat a good amount of meat, you're probably getting enough. Bodybuilders like the extra. Here's the thing. It's in if you don't eat meat a lot. It's in if you're, not thinking as well, they said, or you think you need more muscle strength. It's in if you don't take more than 5 grams a day. Taking the 10, 15 grams a day that some do can actually damage your kidney and cause kidney damage. So that's the caveats to it's in, or otherwise it's out.
Okay. Collagen.
Large molecule normally, now they process the molecule and it has some good to it. I don't use it personally a lot for patients. Pretty much everyone tries it because they think it makes them beautiful and keeps their collagen healthy. I think you need to go to the basis of collagen, what starts it, things simple. Vitamin C. You need vitamin C to make collagen. Collagen is one of the tissue that takes 30 years before it starts to disappear. You need to start early. And, everyone wants the panacea. Oh, we take collagen, it's okay. So a little bit of collagen. Do I have a problem with it? No. Is it typically in my protocols? No. But it's not totally out.
Okay.
It's there.
It's a maybe.
It's a maybe, exactly.
Maybe. Intermittent fasting for women and men.
Good idea.
Good idea for both.
Very good.
Okay.
I think, trying to do intermittent fast, not stuffing yourself like a chicken, maybe eating that 8-hour block a day, 16 hours, you're not eating. Yeah, I think it's good for you. Okay. I think it gives a rest to the pancreas. It also gives a rest to a lot of the metabolic systems. Good idea.
Okay, in. Okay.
In.
Alcohol.
In and out. I think it's what context it's in. If you have a drink socially with friends or your husband here and there, I think it's okay. It would be in. I think a nightly thing, the old point system was, a certain amount, but now the point system got worse. And even, let's say, a glass of wine nightly can increase breast cancer risk and things of this nature. So it's in and out. I think social context type of thing in. using it crutch-wise every day out.
Out. Okay. Coffee. We already talked about that. You
I
like
did.
the coffee.
I like coffee. Coffee is in with a caveat. The caveat is most of the trees are sprayed with fungicides, insecticides, and pesticides, most. So if you get a good organic roast and you make sure there's no mold in it, get it from a good source, a local source or whatever, roast it fresh every day. I really believe that there are studies that show women that drink the sweet spots between 2 and 4 cups a day, they live the longest. So I'm saying it's in.
It seems like that's like a lot of coffee.
I'm still drinking the little bit of coffee that she gave me here, which before, and I love, yes, my 2 cups of coffee a day. And it's, what too, it's my time with my wife. I wake up every morning. I go to my wife with a cup of coffee before she gets out of bed and a love note every single day.
Love note?
Every day. And that's how I start her day, because I want her to start the same day that I do, with purpose, with wanting to get out of bed. I get up early. I make sure she has that, a note. I read her the note. And then she'll come sit in the kitchen with me, and we sit and talk about the day, what we have to do, what are the kids, the grandkids, whatever it is, what we have to get done with work, the podcast, whatever. And then we go on with our day. So coffee is an integral part of my day. I'm not saying everyone has to drink it. There are people that are sensitive to it and they stay up. It's too much. Yes, the decaf coffee, if it's organic decaf coffee, water decaf, it's still okay. It still gives you a lot of the chemicals that make you feel good.
I understand the ritual, though. I do like that
It's a
for the
ritual.
people that do it. My husband does it. He does not bring me a love note, so I'm going to have a conversation with him.
Yeah, let him hear this and just hear, Dr. Mitch said, you have to bring me that love note every morning. You better be bringing one tomorrow.
That's right. Maybe he'll get those 21 ejaculations if he...
Oh, my gosh. I'm going to send this podcast to my wife. Please mark that and make sure I have that. Thank you.
I need the love note.
Yes. Oh, okay.
And a cup of tea.
There you go. You get
No
it.
coffee for me, but... okay, so we already know bioidentical hormones for you, right? Because we talked about that.
Yes, of course.
Exosomes.
Oh, exosomes and stem cells. So I'm going to talk from a point of reference. I started stem cell work in this country a long time ago in the 2000s, and there's a tough story associated with that. And if ever you want to go, I'd be glad to talk about it. But right now, and I like them, I think stem cells and exosomes in the right person for the right problem, delivered the right way, not just flooding the body or putting it in, just haphazardly, which so many clinics do, is not the right way to do it. Doing it for the correct person for the correct time, as we said a couple times during the podcast. The other thing is, though, they're illegal. The 15th Circuit Court, as far as I know, does not like them. And so I'm not going to do them until it's really accepted. And I'll give you case in point. People call me all the time because they know I was the pioneer in this. And a very nice person who visited some other clinic, she said, this person said, you got to talk to Dr. Mitch about it. He's used it way before anybody. He's an expert in it. And I used to teach it. So she called. I said, look, you sound lovely. You're a nice person. I don't want to waste your time, but I want to ask you just one question. Can you give me something from the FDA that says what you have is totally illegal? She goes, no, we have our doctor sign that the FDA doesn't approve them. I said, then I'm not using them. I said, you want to give me something from your lawyer or convince a lawyer that I have that they're okay and that no matter what, you'll defend someone who has a problem. Because they don't have to go after one person, right? I said, no, it won't happen. I know it won't happen. And we talked for 10 minutes. The end of the conversation was, I'd like to come work for you.
They were like, oh, I like this guy.
She did.
He's got
she
character.
So I said, come over, meet me. You never know. I try to meet as many people as I can in my sane, busy day. So I try to keep that on the top of my list.
Yeah, okay. Frequency healing.
I think there's something to it. Now, in that red bed that I have, I was talking about, that red bed has what's called no-gear frequencies. No-gear is a French who did the auricular therapy, and he put the frequencies that he said he noticed when we're developing help the embryo develop. So I'm okay. I think frequencies are in. A haphazard use of frequencies, no. It's very difficult to decide what frequencies you need. For example, when I use it in my office in that huge red bed, I will often say, you go through all this 7 no-gear frequencies. Sometimes for someone who's really uptight or something, I'll say, no, use the D frequency or use the one for the sympathetic nervous system if I see in the thing. And I believe it has some proclivity to help. Can I tell you with great scientific effort that it does? But then again, can we tell with great scientific effort anything really is perfect? So it's in. Yeah,
Okay.
I will put it on the in list.
I like like that. I like that. Parasite cleanses.
And I'll try to say this without saying a bad word. They take these things, these different things, and everything from oils and aracidic and walnut seed, and I get it. I know all about them. And for the most part, they're pooping like crazy. They come back saying, I saw all these things in my poop. Truth is, most parasites are not seen. They're tiny. They're only under a microscope. Of course, if you had like a tapeworm coming out, you're not going to kill it anyway with the parasite cleanse. So if you really wanted to know, and 80% of the world, not the Americans, but they're catching up. 80% of the world has parasites in their liver. If you're a pork eater, you have parasites most likely if you even ate it one time raw. If you eat ham or something that's not cooked, you have parasites. Plus, they have all sorts of viruses like Nipah virus, things that you don't want to have. So if you want to know, the best way to know, I mean, you can't do a liver biopsy to look for them. That's certainly not consistent with something that's easy. You could do that CDSA, that colon, complete digestive stool analysis. It will look for 36 parasites and worms, all this type of thing. And if there's something there, I will highly recommend it once a year. But even if you've ever been out of the United States, you know, and you ate outside the U.S. and you were in a foreign country, you probably should look. And I wouldn't indulge in a parasite cleanse. I'd find out exactly what you have and then take the right anti-parasitic agent. That makes sense. Now, I use a lot of anti-parasitic agents because they have a proclivity to block the pathways in a cancer of circulating tumor cells, which are responsible for more than 90% of the metastasis. And the oncologic community doesn't have that. It will maybe knock them down, but there's really no chemo-directed, any type of therapy, immunotherapy, nothing like that, that can take away these circulating tumor cells per se. So they have done studies, and mostly from what's called the REDO study back in the 1912, where they looked at Harvard, MIT, and Dana-Farber, looked at 6,500 drugs. A good third of them are antiparasitics. And it may not be because there's parasites in the tumor, but the way the pathways they work to stop the parasites block these pathways that allow those circulating tumor cells to do their dastardly deed. So that's the way I would do it. So parasite cleanse, in general, the word, no, because you don't know what you're treating. It's like I'm detoxing. I always said, what are you detoxing? And no one could ever give me a good answer. Well, I'm just detox. I know if I don't know if that's on your list, that would be a no. But finding out exactly what you're toxic with and finding out exactly what parasite you may have in your system, that would be on my yes list for sure.
Okay. Keto diet.
I think the keto diet has something to offer, but like all diets, it should be shortchanged. We should really look at a diet that is sustainable, long time, good for us. Mediterranean diet. It's balanced. It's got fats. It's got complex carbohydrates. It's got proteins. It's balanced. The plate's balanced. Now, I understand people want to do something. Keto diet, I feel good because the brain works on ketones after sugar is used up. You feel good. They lose weight quickly. But you have to also understand there's a negative to it after a certain amount of months. You're eating a lot of protein. And I had this conversation once with the one who did the protein bars. He died. I think of him he's Atkins, Bob Atkins.
Yeah.
He was on one of my committees one time. I said, Bob, you know this diet, which is a high protein diet he did, ketogenics fairly high protein too. I said, you know, over a short time, 90 days, I'm okay with it. But long term, I think there's an issue, a real issue. He goes, what do you mean, Mitch? I said, well, Bob, think of it this way. Do you know that every time you eat a food, that food has to be buffered in 20 minutes? Whatever meal you have, you're 20 minutes or you're dead. You're straight lined. So I said, let's look at a carbohydrate or a fat. There's an equal amount or molar amount of bicarbonate the pancreas produces to neutralize that acid. I said, when you ask someone to eat all that protein, and people push protein like crazy in this day and age, and there's all sorts of biohack, and then I see the side effects. These people come to me, they're ill, but I can tell you. So how do you buffer them? Well, the body only has a few buffers. You can breathe faster to breathe off your CO2. Can't do that. You can use the bicarb. Well, there isn't an equal molar amount of bicarb for these acids because the proteins break down to their different amino acids. They become one of several acids, strong acids, nitric, sulfuric, phosphoric acid, hydrochloric acid. So the body has to knock it out depending what's been made. So you don't have enough bicarb to take care of it. So where's it coming from? It's going to rob your bones. And here's the worst part. You rob the number 1, 2, and 3 intracellular minerals. So for example, if you have something that's high in hydrochloric acid, these proteins, your body, let's say, will rob the magnesium. You get magnesium chloride. it's a lesser acid. Or you get potassium chloride, it's a lesser acid. Or you get zinc chloride, it's a lesser acid, still an acid, but your body can excrete it. And people don't realize you can't excrete these unless the body can raise the pH, the acid base, 1 being a bad acid, which is the ones I just talked to, 14 being like lye alkaline you put on a lawn. You have to raise it to a 5, you'll burn your kidney shut the very first time you drink something that's that low. You can't live. So what happens if you rob the insides of those cells all the time? Oh yeah. Every person over 50 I see has at least 1, if not 3. They'll have either iodine low, they'll have the potassium red blood cell low, it's where it sits. They'll have zinc that's low in the red blood cell, copper goes low. Everything is stolen because you have to buffer these acids. So the answer to ketogenic acid is caveat, no more than 90 days, folks.
No more than 90 days. 90 days, can you cycle and then cycle it again?
Yes.
Okay.
It's like anything else. If you do it for 90 days, just go off for a month and do something very sustainable like a Mediterranean diet or similar. When I go back on, another 90 days, sure. But don't leave out the part where you need to check your biochemistry and your physiology, and especially your biological terrain. Again, because if your terrain is very acidy, that's how people get autoimmune disease, cancer, heart disease. They occur in that terrain. Did you check it? Oh, I don't know what that is. Okay, then you need to get to someone that knows how to check it.
Okay. Dr. Mitch Ghen, what is your last word? I've got to know, is there anything we left out? I feel like we covered a lot.
I think my best advice is the following. Live by the adage, there's no always and there's no nevers. Nothing always is going to help you. Nothing, if you don't do it, won't help you, and vice versa. Find out who you are individually. Guide yourself to someone that is going to look at your biological terrain, your biochemistry, and your physiology. Guide yourself to someone who's taken the time and the years to really, really be in the space, not just join the space because somebody who is a layperson bought a clinic and asked them to come over and just deliver whatever makes money. The point is, it's okay to spend money on your health. I agree you should, but make sure it's being spent wisely. And if you do have the time, take the time and go to GenMed, GHEN-Med, MED.com, and look at that 30-day challenge of how you can clean up your body. And there's other things there. It doesn't have to be me, but do get to someone who's confident, knows this well, and who's really out for the most important thing, and that's for you. I wake up in the morning, I go to sleep. I ask myself the same question, Kimberly. Did I do okay today? God, did I help people today? And as soon as I get how I did and I replay that in my head, I wake up the next morning with intent, with purpose. I give my wife a kiss and I say, thank God I'm here today to do more. Thank you for having me.
Oh, thank you so much for being here. You are very special. What a treat.
Thank you. Pleasure.
Thanks for tuning into this episode of The Cinnamon Effect. If you enjoyed our time together, don't forget to hit that follow button on your podcast app and sprinkle a little love by leaving us a 5-star rating and a quick review. Your support means the world to me. For even more goodness, check out the show notes where you'll find links to some of my favorite products. And don't forget to visit thecinnamoneffect.com to connect with me directly or to grab your TCE gratitude journal, your next step towards a more grateful life. I can't wait to spice things up with you again next time. Stay vibrant, stay inspired, and remember to add a little cinnamon to your life every day.